Today I will be talking about oppositional defiant disorder, also known as ODD. Oppositional defiant disorder is defined as a recurrent pattern of negative, defiant, and disobedient behavior towards authority figures. It is seen in about 3% of the population worldwide. There is no single known cause of this disorder, but all children with this disorder tend to be easily angered, much like the girl seen in this picture. Other contributing factors to oppositional defiant disorder are children who live in unstable homes, such as having very strict or very relaxed parents, being in poverty, or living in an unsafe environment. Knowing about this disorder is important to nursing because you can recognize signs and symptoms of it and help refer these children to the correct doctor or psychiatrist to get them help. You might possibly care for children with this diagnosis, and as you have heard about the defiant behaviors that come along with it, it's easy to understand how these children can be hard to care for. It is important to know how to interact with them and what treatment is best for these children and their parents. The problem with this disorder, which is a DSM-5 diagnosis, is that it is not always recognized by everyone else as a disorder. I had a nurse during my PIT rotation who cared for a child with oppositional defiant disorder, but she was easily frustrated and said that she thought the client just needed more strict discipline. This child and her caregiver probably could have found benefit from therapy referrals. This diagnosis can also be an indicator of trauma, which may need further assessment of the patient, and these kids need treatment such as the referrals that could have been given to the child during my PIT rotation. As oppositional defiant disorder is a psychiatric diagnosis, it's no surprise that cognitive behavioral therapy is an important way to treat this disorder. Parents and the child should both be involved in therapy for the best outcome. Early intervention is also important. As the child gets older, these behaviors become more permanent in their lives. Once they become about 8, these behaviors are more likely to become permanent. Parent training programs help give parents education on types of parenting that can affect or cause the defiant behaviors and allows parents to correct their training mechanisms towards their children. Treatments like these solve the problems that children are having and can be recommended by nurses like you and me for better outcomes for the patients. Often patients with oppositional defiant disorder also have other comorbid disorders that can be treated with medication to help relieve these symptoms, which might help relieve the ODD overall. Here are the references where I got my information.